Understand the massive stroke that killed Pope Francis. 13. Silent symptoms and how to protect yourself. Can you imagine waking up one day and not being able to speak or move half of your body? Ever wondered what it would be like to lose, in a matter of minutes, the ability to live independently? What would you do if the silent symptoms of a stroke started to appear at this very moment? A stroke, known as a stroke, occurs when blood flow to a part of the brain is interrupted, causing brain cells to die. This devastating event can happen to anyone at any time, as we have seen recently with the case of Pope Francis, who surprised the world with his state of health. Time is brain. Every minute counts when it comes to identifying and acting against a massive stroke. Over the next few minutes, you'll learn to recognize the early signs that can save your life or that of someone you love. Stay until the end, as the 11th sign is the most dangerous. Let's get started. The invisible shadow that can change your life in seconds. Stroke, or stroke, is one of the most devastating and unpredictable diseases that exist. It strikes without warning and can turn an independent person into someone in need of constant care. The numbers are alarming. Every 6 seconds, someone in the world suffers a stroke. Every 3 minutes and 11 seconds, someone dies from a stroke in the United States. In the United States, there are approximately 795,000 cases of stroke per year, making it the 5th leading cause of death. But what makes this medical emergency even more frightening is its ability to disguise itself. Many early signs of a fulminant stroke are confused with common everyday problems. A simple headache can hide a bleeding process developing in the brain. A momentary tingling in the arm may be the first sign of a clot blocking a cerebral artery. That sudden dizziness may indicate that your brain is being deprived of vital oxygen. These seemingly harmless symptoms can precede a fulminant stroke by hours or even days. The case of Pope Francis is a perfect example of how these signs can be easily overlooked. Prior to his hospitalization, reports indicate that he had subtle symptoms that went unnoticed. But after all, what exactly happens in the brain during a stroke? And why does every second count when we talk about this medical emergency? What causes a fulminant stroke? A stroke happens when the blood supply to a part of the brain is interrupted or drastically reduced. There are 2 main types: ischemic, caused by a blockage in the arteries, and hemorrhagic, caused by a vascular tear. Ischemic stroke accounts for approximately 85% of all cases recorded worldwide. It occurs when a blood clot blocks an artery that carries blood to the brain. These clots can form locally, thrombosis, or travel from other parts of the body, embolism. Each uncontrolled risk factor exponentially multiplies your chances of suffering a fulminant stroke. Hypertension is the #1 villain, increasing the risk of a cerebrovascular event by up to 6 times. Untreated diabetes can double this risk, as well as complicate recovery after the event. Smoking damages the walls of blood vessels and increases blood viscosity. Atrial fibrillation, a common type of cardiac arrhythmia, increases the risk of ischemic stroke by 5 times. High cholesterol contributes to the formation of plaque in the arteries that can break off and travel to the brain. A sedentary lifestyle, obesity, and chronic stress create the perfect environment for the development of these factors. Hemorrhagic stroke, although less common, is often more devastating in its effects. It occurs when a blood vessel ruptures, spilling blood directly into the brain tissue. The pressure of bleeding compresses brain tissue and dangerously increases intracranial pressure. Arteriovenous malformations and undetected aneurysms are common causes of this type of stroke. Is it possible to reverse the brain damage of a stroke? The human brain is incredibly resilient, but also extremely vulnerable to a lack of oxygen. Every minute without proper treatment, approximately 2 million neurons die irreversibly. The first 4.5 hours after the onset of symptoms are considered the golden window for treatment. Brain recovery is a race against time where every minute represents millions of neurons saved. During this window, thrombolytic medications can dissolve clots and restore blood flow. RTPA, recombinant tissue plasminogen activator, is the main drug used in these cases. Studies show that 40% of patients treated in the first 3 hours recover almost completely. Mechanical thrombectomy, where the clot is physically removed, can be effective up to 24 hours in selected cases. In hemorrhagic strokes, surgeries to drain the bleeding can reduce pressure on healthy brain tissue. After the acute phase, neuroplasticity, the brain's ability to reorganize itself, becomes fundamental. Intensive physical therapy stimulates the brain to form new connections, compensating for damaged areas. Occupational therapy helps the patient to readjust to daily activities after the stroke. Speech therapy works on the recovery of frequently affected speech and swallowing skills. However, prevention and early recognition of symptoms remain the best strategies available. Would you know how to recognize the signs of a stroke and act in the first crucial minutes? What tests should I do to identify the risk of a stroke? Prevention starts with knowing your personal risk factors through regular checkups. The annual checkup with blood pressure measurement is essential. Hypertension is the main modifiable risk factor. Blood tests to check cholesterol and triglyceride levels should be performed regularly. Knowing your health numbers is just as important as knowing your bank password. Both protect your future. The glycated hemoglobin HbA1c test helps identify diabetes or prediabetes, important risk factors. The electrocardiogram can detect cardiac arrhythmias, especially atrial fibrillation. The echocardiogram assesses heart function and can identify potential sources of clots. Carotid Doppler ultrasound checks for plaque or narrowing in the major arteries that feed the brain. Brain MRI can detect small silent strokes that have occurred without noticeable symptoms. Cerebral resonance angiography visualizes blood vessels and can identify aneurysms or malformations. Blood coagulation tests are important for people with a family history of thrombosis. Ambulatory blood pressure monitoring, ABPM, detects concealed hypertension or hypertension during sleep. Lifestyle assessments, including diet, physical activity, and stress, complement medical examinations. These tests are a small investment when compared to the physical, emotional, and financial cost of a stroke. The fulminant stroke that killed Pope Francis. Understand the 13 symptoms and how to protect yourself. 1. Unexpected tingling. The first alarm your body sets off before collapse. Sudden tingling on one side of the body is often the first sign of an impending stroke. This symptom appears when blood flow to a certain area of the brain begins to be compromised. The sensation can be compared to when your arm or leg falls asleep, but with no apparent cause. Tingling usually affects only one side of the body, right or left. It can start in the fingers and spread to the arm, leg, or face. Sudden unilateral numbness is an emergency sign that should never be ignored. Many people confuse this symptom with orthopedic or posture problems. This sensation can appear and disappear in the days leading up to a fulminant stroke. Loss of sensation can affect from small areas to half of the entire body. In some cases, the person may drop objects without realizing it due to loss of sensitivity. Studies show that this symptom appears in about 65% of stroke cases. What makes this sign particularly dangerous is that it can be painless and temporary. When numbness affects the face, it can cause facial asymmetry, one of the classic signs of stroke. The time between the onset of this symptom and a full-blown stroke can be as little as a few hours. Could you tell the difference between a simple tingling and a sign of stroke? 2. Lost words. When your brain starts to fail and no one notices. You're having a normal conversation, and suddenly you can't find simple words. This isn't just a momentary forgetfulness. It's one of the most alarming signs of an impending stroke. Speech difficulty occurs when specific areas of the brain responsible for language are affected. The words may seem scrambled in your mind, like an impossible puzzle to put together. You may realize that you are speaking nonsensical sentences, but you cannot correct the mistake. This communication disorder, called aphasia, is a critical sign that precedes many fulminant strokes. People close to you may notice that you are speaking in a slurred or confused way. The ability to understand what others say can also be compromised. Studies show that about 40% of stroke victims have some type of aphasia. This symptom is especially confusing because the person may not realize that they have altered speech. Aphasia can affect writing and reading, not just speech.
Spoken or written communication can be incomprehensible to those who observe.
Pope Francis, according to reports, had moments of confusion in his speech before his hospitalization.
3. The world goes out. The vision that disappears without warning.
Imagine reading this text and, suddenly, part of the words just disappear. Sudden visual problems are alarming signs that precede approximately a quarter of stroke cases. Vision can be affected in several ways: blurring, double vision, or partial loss of the visual field. Many people report a curtain that descends over one or both eyes. This symptom occurs when blood flow to the visual areas of the brain is compromised. Stroke-related visual loss is different from common vision problems. It happens suddenly and painlessly. Double vision, diplopia, is particularly worrisome and almost always indicates a neurological problem. Some people experience vision loss in only half of the visual field of both eyes. This phenomenon, called hemianopia, is a characteristic sign of impending brain damage.
Patients often confuse this symptom with common eye problems, delaying the diagnosis. The visual change can last only a few minutes and then disappear, which is just as dangerous. These mini episodes are called transient ischemic attacks and often precede a major stroke.
Studies show that between 15 and 25% of stroke victims experience visual symptoms.
4. The explosive pain, the brainstorm that precedes disaster.
A devastating headache, unlike any you've ever felt.
This is no ordinary pain. It is described by patients as the worst headache of my life.
Stroke-related headache usually appears suddenly, like thunder. This particular type of pain can indicate a hemorrhagic stroke, which is especially dangerous and often fatal. The pain can be so intense that it causes nausea, vomiting, and extreme sensitivity to light.
Approximately 30% of hemorrhagic strokes are preceded by this thunderclap headache.
Unlike migraines, this pain has no previous signs and reaches maximum intensity in seconds. The pain is usually concentrated on one side of the head or the back of the skull.
Common pain medications do little or nothing to alleviate this alarming symptom.
This pain can be caused by bleeding into or around the brain, pressing on sensitive structures.
People with a history of high blood pressure are at higher risk of experiencing this type of hemorrhagic stroke.
The pain may be accompanied by stiffness in the neck, another sign of brain bleeding. Even less intense headaches, when accompanied by other symptoms on this list, should be treated as an emergency. 5. The ground that disappears. When your balance suddenly leaves you. You get up and, inexplicably, the world seems to revolve around you.
Sudden and severe dizziness, especially when accompanied by other symptoms, is a classic sign of stroke.
This symptom occurs when areas of the brain responsible for balance are affected by a lack of oxygen.
The sensation can range from a slight imbalance to severe vertigo that prevents standing. Many people describe it as if the ground is moving or sinking under their feet. Seas that affect respiratory control are especially dangerous and can quickly become fatal. Approximately 15% of stroke patients have some degree of respiratory distress. Normal breathing requires complex coordination between multiple brain centers and nerves. When this coordination is compromised, the rhythm and depth of breathing are affected. Often this symptom is confused with heart or lung problems, delaying the correct diagnosis. Shortness of breath may be accompanied by a tightness sensation in the chest, causing further diagnostic confusion. In severe cases, there may be periods of apnea, complete pause in breathing. The family may notice changes in the person's breathing pattern before other symptoms appear. Irregular breathing, especially when accompanied by other neurological symptoms, is a sign of high alert. Rapid treatment can prevent permanent damage to the brain's respiratory centers. 6. Mind collapse. The confusion that no one recognizes as an emergency. Suddenly, you don't know where you are, what day it is, or what you were doing. Sudden brain fog is one of the most overlooked signs of an impending stroke. This symptom occurs when areas of the brain responsible for cognition and orientation are deprived of oxygen. The person may appear disoriented,
ask repetitive questions, or not recognize familiar people. In some cases, there is difficulty in performing simple tasks that were previously automatic. Stroke-related confusion differs from that caused by dementia. It appears abruptly, not gradually. Family members often report sudden changes in the person's behavior before the stroke diagnosis. The person may appear to not be themselves, or act in a way that is completely outside of their normal pattern. Approximately 25% of stroke victims have some level of mental confusion.
This symptom is particularly dangerous because it can prevent the person from seeking help themselves.
The confusion can range from mild disorientation to a delirium-like state. Pope Francis reportedly had moments of confusion before his hospitalization.
If you noticed that a family member is suddenly confused or acting strangely, would you recognize the danger? 7. Force betrayed, when your muscles decide to no longer obey. Imagine trying to raise your arm and finding that it just doesn't respond to your command. Sudden weakness, especially on one side of the body, is one of the most recognizable signs of a stroke.
This symptom occurs when areas of the brain responsible for motor control are damaged. The weakness usually affects an entire side of the body, arm, leg, and sometimes the face on the same side. Some people report a feeling of heaviness or dead weight in the affected limb. Hemiparesis, weakness on one side, or hemiplegia, paralysis on one side, are classic signs that should never be ignored. In some cases, the weakness may begin subtly and worsen over minutes or hours. Simple tasks like holding a cup, writing, or walking suddenly become challenging. The weakness can be so subtle that the person tries to compensate without realizing the real problem.
Approximately 80% of stroke victims experience some degree of muscle weakness. The recovery of muscle strength after a stroke depends directly on the speed of treatment. Therefore, outside observers often notice the problem before the person himself.
Sudden muscle weakness with no apparent cause is always considered a medical emergency. 8. Silent suffocation, the panic of not being able to swallow. You're drinking water, and suddenly you feel like you can't swallow normally. Sudden difficulty swallowing, dysphagia, is an often overlooked symptom of impending stroke. This signal appears when areas of the brain responsible for swallowing reflexes are compromised.
The person may cough or choke when trying to swallow solid or liquid food.
In more severe cases, there is complete inability to control the throat muscles.
Stroke-associated dysphagia can lead to aspiration pneumonia, a potentially life-threatening complication.
Approximately 50% of stroke patients have some degree of difficulty swallowing. The sensation is described as if the food or drink stops midway or goes to the wrong place.
This symptom may appear before other more recognizable signs of stroke.
Swallowing is a complex process that involves multiple nerves and muscles controlled by the brain.
When neural control is compromised, the coordination of these muscles fails. Dysphagia can range from mild difficulty to complete inability to swallow.
Family members may notice that the person is drooling or dropping food from their mouth. 9. Frozen face, the mirror that reveals what's to come. Look in the mirror and try to smile. If one side of your face doesn't move like the other, it's an alarming sign.
Facial paralysis is one of the most visible and recognizable symptoms of a stroke.
This sign occurs when the facial nerve is affected by a lack of blood flow in the brain.
Facial asymmetry usually affects only one side, leaving half of the face drooping or expressionless.
The smile test is one of the simplest and most effective ways to quickly detect an ongoing stroke.
Facial stroke paralysis is different from Bell's palsy in that it is usually accompanied by other symptoms. The person may not be able to close the eye on the affected side or have a deviation of the mouth when speaking. Approximately 65% of people with stroke have some degree of facial paralysis. The control of facial muscles is extremely complex and requires multiple brain areas functioning perfectly. Family members often notice facial asymmetry before the person themselves. Rapid treatment can completely reverse facial paralysis in many cases.
In the case of Pope Francis, reports indicate that observers have noticed subtle changes in his facial expression.
Facial paralysis can appear suddenly or develop over minutes. 10. Disobedient body, when your movements give you away.
Suddenly, his movements become clumsy, as if his body has forgotten how to coordinate itself. Sudden motor incoordination, ataxia, is a significant sign of brain impairment. This symptom is particularly common in strokes that affect the cerebellum, the brain's coordination center. The person may knock over objects, trip for no reason, or be unable to perform precise movements. The inability to coordinate actions that were previously automatic is a serious neurological sign that requires immediate attention.
Simple tasks like buttoning a shirt, writing, or bringing food to your mouth become surprisingly difficult.
The finger nose test, where the person tries to touch their nose with their index finger, often reveals this problem. Approximately 30% of stroke patients have some degree of ataxia. This symptom is often confused with alcohol intoxication due to the similarity of the external signs. Incoordination can affect speech, causing dysarthria, difficulty articulating words clearly.
The cerebellum, often affected in these cases, is responsible for the timing and precision of movements.
Stroke-related ataxia usually appears abruptly, not gradually. 11. Desperate heart, the accelerated beats that no one should ignore. Your heart races for no apparent reason, beating as if you're in a race you haven't started. Severe heart palpitations can be both a risk factor and a symptom associated with stroke. This sign is particularly important in strokes related to atrial fibrillation, a common arrhythmia. The sensation is described as racing heart, beats jumping, or fluttering in the chest. Atrial fibrillation increases the risk of stroke by 5 times and can be both a cause and a consequence. Palpitations may begin days before other, more recognizable stroke symptoms appear. The irregular heart rhythm can cause clots to form that eventually travel to the brain. Approximately 20% of strokes are associated with heart problems, especially arrhythmias. An irregular pulse, especially when accompanied by dizziness or shortness of breath, should be considered an emergency.
Cardiac monitoring is an essential part of stroke treatment and prevention.
The heart-brain connection is crucial. What affects one often impacts the other. Pope Francis, according to medical information released, has a history of heart problems. 12. Missing air, when breathing becomes a sudden battle. Breathing, that automatic act that we perform about 20,000 times a day, can suddenly turn into a challenge. During a stroke, particularly those affecting the brainstem, the feeling of suffocation can be terrifying.
Imagine feeling as if an invisible hand is squeezing your throat, blocking the passage of vital air. Panic sets in when each breath requires a conscious and desperate effort on the part of the patient. The battle for oxygen becomes the center of existence, eclipsing any other thought or sensation. The brain, the silent commander of our breathing, loses its ability to orchestrate this vital rhythm. When neurological control of breathing is compromised, the body enters a state of maximum emergency. The breathing rate becomes chaotic, sometimes accelerated as after a race, sometimes dangerously slow.
Patients describe the distressing feeling that the air simply does not reach the lungs, despite the effort.
Family members report unsettling sounds, snoring, stridor, or wheezing without any physical effort.
This difficulty breathing can appear alone or accompanied by other neurological symptoms. The tragedy of this manifestation is that many confuse it with anxiety, asthma, or heart problems. Many patients, including Pope Francis, have had subtle respiratory changes before diagnosis.
The respiratory centers located in the medulla oblongata are extremely vulnerable to lack of oxygen.
In severe cases, the patient may alternate between hyperventilation and apnea, moments without any breathing. Neurologic respiratory failure can progress rapidly, requiring emergency intubation. Recognizing this symptom early can literally mean the difference between life and death.
The sound of abnormal breathing may be the last warning before a fulminant stroke fully manifests.
13. Stomach in revolt, the digestive signal that hides a brain emergency.
Intense nausea and unexplained vomiting arise without any apparent digestive problems.
This symptom is particularly common in strokes that affect the back of the brain. Stroke-related nausea usually appears suddenly and can be extremely intense. Approximately 25% of stroke patients experience nausea or vomiting.
When combined with severe headache and dizziness, nausea and vomiting form the classic triad of cerebellum strokes.
Many people confuse this symptom with food poisoning or gastrointestinal viruses. The crucial difference is that stroke-related vomiting often persists even with antiemetic medications. Strokes that affect the brainstem, where the vomiting centers are located, often cause this symptom. Persistent nausea with no apparent cause, especially in people with risk factors, should never be ignored. Vomiting can be so severe that it leads to dehydration, further complicating the condition.
This symptom is one of the most overlooked because it is rarely associated with brain problems.
However, it is a classic sign of increased intracranial pressure, common in hemorrhagic strokes. In the case of Pope Francis, medical reports have mentioned gastrointestinal symptoms preceding other signs. Your life in your hands. Fast-paced action that saves. Now you know the 13 signs that can announce a fulminant stroke before it happens. This knowledge puts in your hands the power to save lives, including your own. Remember, when it comes to stroke, every minute counts, literally. For every minute without treatment, approximately 2 million neurons die. The brain can lose as many cells in 6 hours as it would in nearly 3.5 years of normal aging. Early recognition of symptoms and immediate action are the keys to avoiding permanent sequelae. Memorize the acronym SAMU, smile, hug, music, urgency, to quickly identify a stroke. Smile. Ask the person to smile and notice if one side of the face does not move normally.
Hug. Ask to raise both arms and observe if one of them falls or does not lift.
Music. Ask to repeat a simple phrase and check if the speech is slurred or confusing.
Urgency. If any of these signs are present, call emergency immediately. Don't wait to see if your symptoms improve or worsen. Every minute of delay means more brain damage.
Don't try to drive to the hospital. Call an ambulance so treatment can begin during transport.
Write down the exact time when symptoms started. This information is crucial for treatment decisions. Prevention is always better than treatment. Control blood pressure, diabetes, cholesterol, and stop smoking.
Regular physical activity, healthy eating, and medical checkups are also essential. The knowledge you have gained today can make the difference between life and death, independence or disability. Share this information with your friends and family. The next stroke you prevent could be your own. Life is fragile, but your power to protect it has just become much stronger.